Hello, beautiful people. Welcome back again to my YouTube channel. Thank you for always coming back to watch my videos. What a lovely morning. We have our weekend. It is a Saturday and our weekend has just started. And we thank God so much for giving us an opportunity to see this new day and to continue with our works wherever you are. And whatever you are doing, you are building yourself, first of all. In any work you're doing, you're building yourself, you're building your family, you're building your community, you're building your nation, and you're building the world. And today, I want to discuss something about those who are working in a sensitive place. Sensitive places like the hospital and the police officers. We all know the works that those who work in the as healthcare in the healthcare facilities are doing, and all the things that the police officers are doing. Those who are working in the police department, the type of works that they are doing, they are trying to protect the lives of people and property through enforcement of law and regulations. We know all this, and we also know that the health workers are trying to save lives in all the departments where they are working. They are working as a team to save the lives of the patients. Yeah. So first of all, one thing that those who are working in the police department should know is that working in the police department is a call. Actually, it's a very difficult and hard work there. And even those who are working in the healthcare facilities are called to do their work there. It is just a call to go and save the lives. The way there are, the police officers are saving lives and saving crimes. You see, they are called every time. If you look at your surrounding, wherever you are, even if you're in town, in the village areas, you are going to see the police officers almost everywhere. They are working in the banks, they are working in near the churches, they are working in the people's businesses, they are working everywhere because they are there to save the life and property. And it's the same thing with those who work in the hospital. Yeah, they also save the lives of people. They are in readiness. And what I want to say here is that if you're working in these two places, like being a healthcare worker, being a police officer, know to it that you are called to do that work. It's not easy. You must be called. If you are not called, then you are messing there. But if you are called, do your work well. It is a call, and you have to accept your call and do your work because you are earning, you are living out of it, and you are learning so many things in that place of your work. When you are helping the patients, helping wananchi, you are doing your work, and you have to be in readiness. Readiness and alert all the time. Like working in the hospital, you need to be working as a team, because those who work in the hospital actually need one another. They really need one another. The doctors need nurses need therapists also need even the cleaners, and they need one another like that. It is just a circle that they have to work together, and everybody working in the healthcare facility is an important person, because without this person you cannot do your work. Without cleaning the wards, cleaning everywhere, you will not be working in a clean environment. And without nurses, doctors cannot work. So it is a place that people have to work as a team. And even in the department of communication, you see, we also need to, they also need to have a teamwork, because they are the ones who are receiving everything, every call from outside about even the reports that are coming from the police officer that, oh, there is an accident, the ambulance department, there's an accident, so we are bringing the patients there. There is some things that have happened, we are bringing the patients there, so they are very busy. So it's always necessary to work together as a team, because it is so important. And like also the police officers, they are also trying to help in reducing the crime. In everywhere they go, they also receive very sensitive calls all the time, so they need to be alert that when they are called, they run there very fast. There is fire somewhere, fire has broken out somewhere, there's a problem with it has rained and some houses have you all know the emergencies and the accidents that are happening, and the doctors communicate, the police officers communicate with the health workers, and they take care of the wananchi, they take care of people of their nation, yeah. And everywhere, I think it's not there's no big difference. The work of police officers and the work of health workers is almost the same everywhere. I know we are all important in all the departments we are working on, areas or ministries, but I salute the police officers and I salute the health workers, because they are doing a great work, and they are always very busy all the time. They are called all the time, and they are busy until the time someone is just out of his or her duties is when you rest. Ooh. So you need to love your work. You need to love what you are doing in whichever department God called you. Yes, it is a call. You've been called to work in that area, so just do your work. Give services to the community, give services to your nation, and earn your living, grow yourself in your line of profession, and be sensitive and work together as a team. Especially working in the hospital. Be alert. We now all have our phone calls. We have our phones. Wherever you are called in your department, make your arrangements well so that you be organized in such a way that when it is, you are on call, you can be called anytime. Let it not be found that your phone is not working, that you are mteja haipatikani kwa sasa, that the person you have called is not available, and you are the one on duty, and you are working in a place which is very sensitive, like the hospital, like the police. You are needed any time to save the life of the patients. When you are saving the life of the patients, you are transforming this person and putting a smile on this face of this person again. Imagine when somebody is working in the hospital, you deal with lives of somebody's life, and you make this person feel better again, especially doctors who are in the theater. Oh, I salute you, and may God take good care of you, because you do a great work in theater, and patients get out of theater when they're feeling better and their life is back again to normal, and may God bless you so much. And it is just a teamwork, because you doctors in the theater room work together with the other clinical managers in the hospital. Yeah, that is. And even if you're working in the department of oxygen, if you are working in the department of oxygen, the oxygen can be needed anytime, and you are running very fast. From the time you will leave your work going home, or you are very tired, and you are happy that you saved life. You are happy that you saved life, and you are ready all the time, yeah? Because you are working in a sensitive place. Being ready all the time means you can be able also to acquire more knowledge, even if you are not a nurse or a doctor. You acquire more knowledge of saving lives, even at your own house, even at the neighborhood, even at your own village. You see, at least you have some knowledge that this is being done like this. That's first aids. You can help, and you can even help by being consulted over anything that can be done. You have the knowledge. If we are working in any department in the healthcare facility, don't just be there in your department alone. Arise, know things that are happening in other departments so that you can also be consulted. Because let me tell you, those people who work in the hospital, the people who sees you going to work in the hospital just generalize that you're a doctor, and they know you have knowledge of so many things. So it is good at least to empower yourself so that you know things that are happening there. In any case, there is anything that they want to know from you as a health care, they will be able to at least get something, or you can refer them to the person who can help them. I salute you all, those who are working in the health care facility, the Ministry of Health and the police officer. We all need one another. I know even the education department, it is important, but this time round, I'm just saluting the healthcare workers and the police officers because of the work they are doing and because God called them to do this work. And for you, my fellow Kenyan, if you are called in these areas, please do your work well. God is going to reward you. Even if you're not rewarded with a human being like you, God is going to reward you with the best thing that you have done. If you have done your work well, you know inside your heart, in your mind, that I did my best. When you are leaving your area of work, you know, I did my best today and I saved the life of somebody to the extent that you could. You see, because you are called and you know your work. A blessed Saturday. If it is your first time here, please kindly consider subscribing to this channel. Give me a like. Give me comment down below about this topic and what you think about the clinical workers, the health workers and the police officers with the great work that they're doing. Thank you so much. God continue blessing you, and you have a blessed weekend and a week ahead of us. May God take us through. Amen and amen. Bye-bye.